Do you guys have questions?
So are you anticipating any problem with the vaccine website tomorrow? I know there's a lot of frustration with people trying to get their things last time. And also, for instance, New York City, they're doing a 24/7 at Yankee Stadium allowing people to get vaccines so they can get more people in. Are you considering that as well?
Well, first of all, we've vaccinated on first doses a larger percentage of our population than any other big state in the country. I think the program we've put in place has been enormously effective as making sure we put shots in arms. As I said in my remarks, 88% of all the vaccine that we've received has been administered. And we have many locations around the Commonwealth that people can pursue to get vaccinated. Our problem, and this is a problem in every state in the country, is there are more people who want to get vaccinated than there is supply available to vaccinate them with. And if the feds do in fact manage to enhance the time frame that's associated with how they distribute it, I can promise you this: we have plenty of capacity to put every dose we get to work.
Governor, will teachers have to compete with everybody else who's already authorized starting next week? Are they going to have to go onto the website and battle out there, or are you going to create a fast lane for them, maybe so that they can get vaccinated in places like here, at the workplace, like healthcare workers did early on in the program?
The current, remember, there are still significant numbers of people who are over the age of 65 and have two comorbidities that under the CDC guidelines put them at significant risk of hospitalization and death associated with COVID. And in Massachusetts, 90% of the people who died of COVID so far were over the age of 65. We want everybody who's part of these groups to get vaccinated. But unless we get a significant amount of additional supply, it's going to take a while for people to work their way through the system.
So will they be given a fast website as of this morning you were able to sign up?
On the CVS website as of this morning, it says that teachers are eligible. So have CVS and Walgreens now broken away from the state? They don't adhere to state guidelines?
No, everybody's still playing more or less by the same rules. And if you're eligible in Massachusetts, you're still eligible in Massachusetts to use CVS, Walgreens, and the other retail pharmacies. But they're adding, as we're planning to do as well, educators to that community.
Governor, is this something that you would have done had the Biden-Harris administration announced this directive yesterday? Because the educators, we've been calling on this for a long time now. And then separately, you mentioned specific days for educators at these mass sites. So they're teaching. So I'm wondering how they're going to be booking appointments and teaching, if you can answer both of those.
Well, first of all, the education community was right after the 65 plus and the folks with two comorbidities on our list. And remember, our list came from an advisory panel here in Massachusetts that prioritized, first of all, preserving life. And the data is simply overwhelming. The people over the age of 65 and people with multiple comorbidities are the ones who are most likely to be hospitalized and most likely to die. And we felt it was really important that they be dealt with early in this process. I don't want people to get confused about where they can go and where they can't go if the federal rules associated with some of this are different. So we're going to move up the educator community, give them the ability to start booking appointments starting next week.
What about the mass vaccination sites, like the specific days for educators? Could you give them out in school buildings even? And also, would you consider giving them the J&J vaccine? They want the one-shot one to get it over with.
Well, keep in mind that the J&J vaccine, as I said, we got 58,000 doses. They've been allocated to primarily healthcare providers, and we're not going to get any more until the end of March or beginning of April, which falls outside the time frame that the president talked about, wanting to see everybody in the education community get vaccinated. If that changes, obviously, it makes it possible to do other things. Although I also want to see us use that J&J vaccine to do some mobile vaccination work because of the ease associated with storing it and preparing it and getting out into some housebound areas and some shut-ins and people who typically can't get to any site. I think with respect to the way we've been thinking about creating days, we would probably put them on weekends when people aren't in school and do it that way.
Governor, has the Biden administration indicated they're going to earmark some of the supply that's sending to the state for teachers?
Not yet. No, they've not. I mean, we were on the phone with the Biden administration for an hour yesterday, and this didn't come up at all. First we heard about it was the tweet yesterday afternoon.
You expect, I mean, given that he's given this directive to vaccinate this month, I mean, are you expecting that at some point, I mean, to have the policy match with what he wants to see?
Well, that's one of the reasons why we moved up the eligibility date, so that it will be reasonably consistent with the eligibility date that he's talked about. But he's talking about it as an add-on. He's not talking about it as a substitute.
We're looking for students to return to the classroom next month. And it doesn't sound.
K through 5, right.
Right. But it doesn't sound like teachers, if they're jostling for an appointment with everybody else, could necessarily be vaccinated. Do you expect some resistance?
People have been here for 101 days. There are schools all over Massachusetts that have been operating in person since September and have done a really terrific job of managing COVID along the way. We've also made available to any school district that wants it, and any school that wants it, a weekly surveillance program that the state is paying for to begin with, and locals can use some of the federal money they've got to pay for if they choose to use it going forward. And the CDC's own guidelines with respect to reopening schools don't require vaccinations for schools to be reopened.
Governor, about Fenway, the season, the soccer are gonna start playing, will that still be considered a mass vaccination site? Is there any plan for that?
We're talking to the folks at Fenway right now about how to handle the issue associated with fans and games, and I think we'll have more to say about that shortly. But the bottom line is everybody who needs a second dose is going to get a second dose, and if we need to move the way we handle first dosing and second dosing going forward, we'll find another place in the city to do it.
Governor, yesterday, Senate President Spilka called.
Can you let me just...
We've seen several states roll back on the mask mandate. Do you have any plans for Massachusetts?
I think the mask mandate has been an important element in both encouraging behavior, but also sending a message about the importance of recognizing and understanding that COVID is still very much with us, and people need to take precautions. And especially with the new variants that are out there, which all the vaccines so far appear to work on. Some of the new variants are even more contagious than some of the stuff we've been dealing with for the past 10 months, 11 months, 12 months. And I think we have no plans at this point in time to change the rules with respect to the mask mandate.
Governor, Senate President Spilka yesterday called on the administration to set aside a certain percentage, she didn't say how much, of vaccine to receive for educators and staff. Is that something that you considered?
She also said that when we got new doses, we're not getting new doses. Okay, I can't make that point clear enough. In the current environment we're operating in, where we have very limited constraints around supply, we have a number of groups that we believe, based on the guidance we got from the CDC and the work that was done by our panel here in Massachusetts, are very significantly at risk of hospitalization and death associated with COVID. Those folks need to continue to be able to access vaccines at the 170 sites where vaccines are available in Massachusetts. We don't want to create confusion. We do want to see educators get vaccinated. We're going to move them up ahead of all the other groups that are part of the next phase of phase 2, next step in phase 2, to begin being able to schedule appointments next week. But I don't see how we can choose to take vaccines away from people who are over the age of 65 and significantly at risk of hospitalization and death from COVID, or people who have 2 comorbidities, many of which have already been proven time and time again to be terribly dangerous when it comes to COVID, and not include them going forward in the process. Now, we think teachers should absolutely be part of the game starting next week, and they'll be able to make appointments. And if the feds dramatically increase supply to help states deliver on this directive from the White House, that would be terrific, because we have the capacity in Massachusetts to do far more vaccinating than we actually have available vaccine.
Last question. By moving teachers up, you said 400,000 more people becoming eligible.
Well, it's not, keep in mind, it's not just teachers. educators, staff, childcare workers. It's a big universe.
By moving that group up, does it set everyone else back?
If the supply numbers don't change, yeah. I mean, the thing people need to remember here is we only get the same number of vials we've been getting for the past few weeks. Now, we can get 6 shots instead of 5 out of the Pfizer vials, which is how we get to 150,000 doses, first doses. But part of what made all of us so excited about the J&J product was the single dose and the possibility to dramatically increase available supply in a really short period of time. But the message we got yesterday was, you know, we got this 58,000 doses, which we allocated, mostly to provider organizations, and we're not going to see any additional J&J that we can order until at least the end of March. Now, maybe at the end of March, we'll get a really big number that comes from the J&J production deal with Merck or something like that. If that happens, that's a big deal because it's one shot. And I can't emphasize how big a deal one shot is relative to 2. It's not just about convenience, it's also about, you know, how you're putting your doses to work. And if we could get to the point where J&J is playing a really big role and we have a ton of one-dose vaccine, that will make a really big difference. I mean, just think about every single person who's been vaccinated so far had to go back and get a second vaccine. So we've administered 1.8 million shots in Massachusetts. About 1.2 million have been first doses, and there are about 550, 600,000 people who are fully dosed. If this was all one shot, instead of having 550,000 or 600,000 people who are fully vaccinated, we'd have 1.8 million people who are fully vaccinated. So the one-shot thing makes a big difference. And if there's a lot more of that supply that shows up, it will make a big difference here and everywhere else.
You would ask to get a better view of the supply chain a couple of weeks ago. Are you getting that at all?
Well, honestly, the news yesterday about J&J was a big surprise to everybody. We thought we were going to see, and this was covered pretty extensively in the media, J&J had very significant commitments that they made as part of their financial support, part of the financial support they received under Operation Warp Speed. And a lot of us were anticipating that once they got approved, they would be delivering on the commitments that were made under that arrangement. They're less than half of what, way less than half than what was originally presumed to be coming in the month of March on the J&J side. Now, maybe they'll make up for it in April. But if I've learned anything since the start of this, it's how important it is for people to have an opportunity, who want a vaccine, to get it, how important it is to put it into the arms of people who either are at risk themselves or work with people who are at risk. And we've done a pretty good job on both of those things in Massachusetts, which I think will make a difference on hospitalizations and case counts and deaths and all the other things that we talk about when we talk about the consequences of COVID generally. But the big challenge here is available supply. And it's been that way now for, well, more or less since the beginning.
Thanks, everybody.
Do you encourage teachers to wait until the 11th to get their appointment as opposed to going to CVS at this moment right now?
If somebody can get an appointment, they should get an appointment. And by the way, they should also take whichever vaccine is available. This is something that the CDC, the FDA, the medical community, everybody has basically said, you know, if you get an appointment, take the vaccine that's available. They all work on hospitalization and death, which are the two things we should all worry about the most. But part of the reason people do talk about the importance of continuing to wear a mask, even after people get vaccinated, is one of the things the vaccine does is it prevents you from getting sick, which is great. One of the things nobody knows at this point is whether if you are in fact infected and you don't get sick and you don't show symptoms, even if you've been vaccinated, are you still somebody who could carry it and give it to somebody else who's not vaccinated? And that's being studied right now in a number of the countries that are a little bit ahead of the U.S. in terms of their population that's been vaccinated. So that's another reason why I think the mask mandate in particular, the mask mandate has nothing to do with whether or not the vaccine's effective. In fact, it's just the opposite. If you have a whole bunch of people who get vaccinated but could still carry the virus and theoretically give it to somebody else and show no signs, that puts people who haven't been vaccinated or people who remain part of a vulnerable population that hasn't been vaccinated at risk. So I think the mask mandate, at least until we get some answers on whether or not people who've been vaccinated can actually pass this on to somebody else, is a perfectly reasonable and appropriate place for us to continue to operate in.
Governor, with governors in other states saying, no, we don't need a mask mandate, things reopening slowly, schools getting back, is there a danger out there that people are going to put down their guard and we're going to be back in a problem situation?
So, I mean, I certainly hope people don't put down their guard. I mean, some of the decisions that we made with respect to our guidance around here in Massachusetts was really simply going back to where we were in the fall, okay? We left in place many of the criteria and many of the guideposts and the standards and the advisories that have been in place all along, and we left some of the ones that we added in December in place as well. It's still 90 minutes in a restaurant, which 6 people, no more, at a table. I think what I would say is that the vaccines, the more we do to serve vulnerable populations and to take the folks who are most likely to be hospitalized, get really sick, be hospitalized, and die, the more we vaccinate those folks and create a certain level of additional safety for them, the more likely it will be that we won't see significant burdens on the healthcare system. We won't see significant numbers of people getting sick and dying, which is great. But at the end of the day, this is still an incredibly contagious virus, and people need to take it seriously until we get to the point where we have vaccinated a very significant portion of our population. Now, if we get a ton of J&J in April, and Pfizer and Moderna continue to up their numbers in April and May and June, we have the infrastructure to vaccinate millions of people in Massachusetts.
To be clear, at this point, no doses set aside for educators and no special days when they will be able.
No, there will be special days.
What are the special days?
We're still figuring that out. We just heard about this yesterday.
Thanks, everybody.
You said last month you didn't want to see vaccination sites do a camel call, as you put it, for unused buildings. Do you think how the state police and your executive officer of safety, is that a fair way to distribute unused vaccines from the state police headquarters?
The protocols that are in place at this point are much better than they were at that point in time. I mean, they all went to people who are eligible, but I don't expect or anticipate that we'll be seeing that sort of activity or that sort of behavior in the future. And we shouldn't. We don't need to. We have better protocols now. We understand more about how to handle this. And I think in some ways, we're, you know, with COVID and with the first time on so many of the issues associated with this, we continue to learn the right way to do a number of things, and that's one more.
Thanks, everybody.
If there are special days set aside, wouldn't that mean that there are doses set aside for teachers?
Yeah.
Those will be appointments that will be reserved just for teachers.
Correct. Well, educators.
Or educators.
Mayor, can we get your reaction? I know you were super excited when you heard that teachers will be vaccinated. Can we hear from you about it?
Well, kind of biased because we're in Gloucester and my teachers and educators have been working since day one. So I've been actually with the superintendent trying to figure out something we can do because I feel that where everyone's saying, well, if you want us to go back to school, then we need to be vaccinated. But my teachers have been. They've been in school. They've been doing everything and following the protocol. And I wanted to get them first. And I was joking around. I said, "Joke, don't nobody get upset." I says, "Let's see, I'll give you my high blood pressure. I'll give you smoking," and, you know, joking around because It's true, though. I'm also an MRC volunteer, and I've been doing from 5 a.m. to 8 a.m. registering people who are 65 or plus. We have a lot of people who are, and I'm asking people, please, do not go online. You get through, and what's happening, they're making appointments all over, and then they're not showing up. And that's what's got to stop. You can't go online and say, I'm going to go Gillette, I'm going to go here, I'm going to go here, I'm going here, because this, and then finally you have something sooner, and then nobody knows. So what we're trying to do is all those appointments, we're now putting 75 plus, and we're putting 65 plus in 2 communities. And if I have to work around the clock with superintendent and with the principals and everything else to get out teachers, I'm going to do that. I'm going to do that. I'm sorry, I'm a little biased. I'm glad that, that the educators are going to be moved up. I think that was a necessity because the fact is, as people get vaccinated and as the weather gets warmer, people seem to, like you said, slack. Don't slack. Wear your mask. The kids are teaching us something right here. You saw them. They were doing it better than we were. So it's my concern, but yes, I'm so happy that they are. And if we can do it on weekends for them, fine. If you want to bring them here, I'll do them. I don't care. Stage 4, I'll put up a tent. I need my teachers vaccinated. I need to protect my citizens. And I'm a little biased because I'm in Gloucester, so yes.